They are fairly good infrastructure, but the biggest challenge we have in this facility, and I think in almost all facilities across this country, is the issue of human resource. We have shortage of staff. And you know, when we talk of shortage of staff, it means we need additional resources to recruit. You can never have an hospital without human resource. And the biggest cost in the health sector is salaries. The biggest cost in the payroll of Murang'A County is the salaries for health workers, because you need so many of them. We've also noted that that this facility has fairly very old equipment. It needs some improvement, but it has given service considering the years when it was established to where it is. This facility has given service, and periodically now it needs to be maintained and upgraded. We've also noted that there is very low patronage of this facility by residents, and we want to urge wananchi around here, Murang'as. The doctors you go to look for in Murang'A town, they were trained with the same doctors you are leaving behind here in Murang'as. Unless there is another compelling reason to go to Murang'A, we want to ask the residents of this place to patronize this facility. It will be extremely expensive for the county to spend additional resources to improve the facility, and wananchi decides to leave these facilities and go to another. The reason people crowd in urban areas is because of the services and social amenities available. If we make it possible for people also in rural areas to have those services, then we cannot see the kind of congestion we are seeing in the urban areas. So we want to thank the county for that, but also ask the CC and the CC is here, that now that there is a new county government that's come in place, there is need to put some additional resources in this facility just to improve, because these are among some of the oldest facilities we have in this country, and they have grown over time. That we have done, of course, as a Senate, is to implore national government to deploy additional conditional resources to counties to support the program of universal health care. And universal health care primarily will concentrate on the preventive and promotive health care as opposed to curative. Counties and national government are going to collaborate to make sure now that we focus on preventive health care. And that's why there is that collaboration. Two, level 2 facilities, through again conditional allocation, will be equipped in every county, again to support the primary health care. As you know, level 2 facilities and level 1 don't concentrate so much on the curative, but they try to do the prevention. And that's why a lot of resources will be allocated to that. But we are yet to complete the whole framework, to sit with the Ministry of Health, the National Hospital Insurance Fund, and the Council of Governors, and work on a seamless framework for implementation.
It is upon us as local leaders to change the perception of the community around here, because I'm the area senator, I know the geography of this place. This is a huge facility where if we do an improvement on the number of staff available, and here you forgot about the lack of reagents in our lab. I think that is also something that is pushing people away. If the county government would be able to improve on a provision of reagents in the lab, and see what to do to make our patients warm, because we have also found that our patients in this hospital, especially inpatients, don't have enough warm blankets. I think if that is done, and the doctors here are doing a very good job, only they are few, so we also still want to ask the county government to see what it can do to bring in more staff, reagents, and whatever is needed to keep this facility running. We have also seen that we need a facelift of the facility. They have been able to explain to us that the seemingly dilapidated doors were actually, the paint on them was occasioned by the use of jik, especially during COVID. And we have agreed that they are going to do, because the CC is here, we have agreed that they are going to do something to do a facelift.